Hello and welcome. Now, the coronavirus pandemic has affected our lives, our economy, our health, and has spread to every corner of the globe. The rapid spread of new variants offers clues as to how SARS-CoV-2 is adapting and how the pandemic will play out over the next several months. The WHO has said the highly mutated Omicron variant of COVID could change the course of the pandemic, and due to the previous lockdown and work-from-home cultures, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Be it diabetes, myths and facts will impact and help a large number of people to prevent or control metabolic disorders. We have with us experts to share with you advice on leading a healthy lifestyle. In fact, let's go across to our doctors now. Dr. Malay Parekh, a consultant diabetologist, Rotary Midtown Diabetes Prevention and Lifestyle Management Center, Rajkot. And we're joined by Dr. Sachin Kumar Gupta, consultant diabetologist, Krishna Diabetes Clinic and Educational Research Center, Bhopal. Thank you so much, doctors, for taking time out and joining us on this very, very important topic for which there needs to be a lot more awareness. Dr. Gupta, I'd like to start with you. It is said that existing vaccines could be less effective against the fast-spreading coronavirus variant. Is this true, and what precautions should people take against it? Right, doctor, we can't hear you. I think you're on mute. If you could just, fix that.
Hello?
Yes. Yes, go ahead, doctor.
Yeah. Can you hear me?
Yes.
Yes. So the results suggested that there is some problem in existing insulin, but now we have booster, and the research from Sweden, South Africa, and this Pfizer and Blog collaboration, they have suggested that if we are giving booster doses, this would be the effect of previous two injections won't wipe out, and it would be helpful for this the fast spreading Omicron virus. So just take booster doses. First we are giving to frontline workers, elderly people, and just don't worry. But apart from all these things, maybe vaccines, everything, just forget to follow COVID protocol. Use mask, keep proper distancing, wash your hands, and don't go to places where there is crowded. So we want to fight the corona, and we can fight it. Okay?
Right, absolutely. And do remember, viewers, if you have any questions, you can WhatsApp them to us. That number is on your screen now. Dr. Parekh, what are some of the symptoms of the Omicron variant of COVID? Are symptoms the same for people with diabetes and heart disease, and how are they different from, the first time around?
Yeah, very nice question. Omicron, a new variant of COVID-19, is much more infectious, and the symptoms are very similar to cold. It includes runny nose, fever, malaise, nausea, vomiting, sometimes diarrhea, persistent cough, altered taste and smell sensation, sometimes chest pain. And so diabetes patients and heart disease patients have similar type of symptoms, but they are more prone to develop the greater complications like myocardial infarction, heart attack, heart failure, myocarditis due to COVID-19 infection. So diabetes patients with heart disease and comorbidities, this type of patients should regularly check their blood sugar level, fasting, postprandial, HbA1c, and should control their blood sugar level in the normal limit.
All right, Dr. Gupta, should people with diabetes get their medicine doses re-looked at by doctors, especially when they're working from home and, in case they put on additional weight as we've been seeing in the last 2 years?
Yeah, we all know that diabetes is not a constant feature. And the sugar levels depends on diet, whatever you are eating. You are munching so many times because you are sitting at home. You are not going for exercise. And stress level, that also increases diabetes. So what to do in such a situation when you are not going out, sitting at home, working from home? You should be very careful. And I would suggest that all diabetic patients should use glucometers and self-monitoring of blood glucose. That is how we test blood sugar, fasting, 2 hours after breakfast, 2 hours after lunch. Check your blood sugar. And government has fortunately approved telemedicine. So constantly be in touch with your doctor, because it's not a constant feature. So if sugars are going up, maybe you can up titrate your doses or maybe down titrate your doses. So just be careful, because at any cost you have to control your blood sugar. If you want to pass this time, be happy, because corona is same in everybody. But if a diabetic patient they get corona infestation, the problem is more. So just be careful, don't sit idly, check your blood sugar regularly and contact your doctor. This is very important.
All right. Now, Dr. Parekh, the widespread fear, helplessness and illness as well as economic hardship caused by the pandemic have resulted in increased stress levels, all around. Has this stress impacted diabetes management as well?
Yeah, definitely. Stress impact on diabetes mellitus management, because there is a direct correlation between stress level and blood sugar level. Higher the stress level, higher the blood sugar level. Even we noticed during the second wave of the COVID-19 infection, uncontrolled type 2 diabetes patients develop more severe complications like mucormycosis. So in this recent COVID-19 stressful era, diabetes control is very, very must. Even 1% HbA1c reduction significantly reduce stroke, heart failure, retinopathy, neuropathy, nephropathy, heart attack, and peripheral vascular disease. And diabetes itself a lifestyle disorder. So diet and lifestyle modification are the main two pillars of the diabetes management in this recently stressful era of COVID-19 to control the micro as well as macrovascular complications to prevent.
Right now, and again, I'd like to remind viewers that they can send in any questions that they may want to ask the doctors on the number on the screen there. Now, Dr. Gupta, hypoglycemia is common in people who take insulin injections. What could be the reasons, and is this preventable?
Yeah, insulin, if I say it's a nectar of life, amrit. But the only side effect of hypoglycemia is low sugar. And otherwise, it's a wonderful thing. We are celebrating 100 years of insulin, and insulin has given life to millions of patients. Can you imagine a type 1 diabetic patient without insulin? There is no life for them, this group of people. Even the type 2 diabetic patient, initially they take insulin, but after some time, after a few years, 7 to 8 years, most of the people, they need insulin. So insulin is amrit. And if you have knowledge about insulin, how to take, when to take, and frequent meals, how to cope up with hypoglycemia. You can just fight with hypoglycemia. It's not a major big issue that would prevent you from not taking insulin. People they are scared about hypoglycemia. But don't scare. Check your blood sugar with glucometer. If you have low sugar symptoms, then just take two spoonfuls of sugar. Maybe you can take some sweetened beverages or any sweet thing and you will be all right. It won't kill you, but one should be careful. If you have knowledge and if you follow all the guidelines given by doctors, hypoglycemia is not a big problem. Okay?
All right, so not something to get too stressed about. Dr. Parekh, having a silent heart attack puts you at greater risk of having another heart attack, which could then be deadly. Why do people with diabetes experience silent heart attacks?
Yeah, very nice question. Because silent heart attack could occur to anyone, but diabetes patients are more prone to develop, because over the time, type 2 diabetes mellitus patients develop a condition, autonomic neuropathy. In this condition, gradually nerve damage occurs. So patient's ability to feel the pain is gradually reduced. And studies have shown that up to 16% of the type 2 diabetes mellitus patients have developed silent heart attack. Even cardiovascular disease is a major cause of the premature death in type 2 diabetes mellitus patients. Even 70 to 75% of the death due to cardiovascular complications occur. And type 2 diabetes mellitus patients have high risk up to 2 to 4 times to develop stroke and heart failure. So type 2 diabetes mellitus patient with heart disease, this type of patients should regularly check their blood sugar level and regularly check their fasting, postprandial HbA1c and should control within the limit, and regularly check the ECG echocardiac workup to prevent the microvascular complication in the future and to prevent the silent heart attack. Thank you.
All right, you're watching Beat Diabetes Myths versus Facts. It's time for us to slip into a short break. We'll be back with more questions for the doctors. Stay with us. Welcome back. You're watching Beat Diabetes Myths and Facts, and we're talking to doctors about issues that you need to know about managing diabetes, especially in COVID times. Let's go across to Dr. Gupta now. And Dr. Gupta, the most important aspect of insulin therapy is using it exactly as prescribed. Still, remembering all the little details can be tricky and certain mistakes are common. What are the right and wrong ways of using insulin?
Yeah. One should follow, first one should learn from doctor or maybe from doctor's assistant that how to take insulin. That is very important, because and it starts from where you are keeping insulin. It should be kept in door of the fridge, not in freezer. That is very important thing. When you take out insulin, just keep it for some time in room temperature and inject on designated places, over abdomen, over thighs, and over that arms also. And it should be 90 degree. Change your needle in 2 days. Sometimes the people, they do not change needle. Sometimes they do not keep it in fridge. And the insulin, that power that it comes down, maybe insulin is wasted. So it's very important to follow the doctors, whatever you have been given. And I would request, and we all should give some pamphlet to our patient, because it's very difficult to remember everything. And the very important thing is titration of the doses if we are using insulin. So you should know, you should contact your doctor that my sugar is going down or going up. Every 3 to 4 days, you have to inform your doctor for titration of doses. Sometimes the patient may come to us after 3 months, 2 months, and they are taking the same doses. So this is very important thing, and you should learn it.
All right. Now, Dr. Parekh, though gyms and parks are open now, people are still a bit afraid to go out. So what exercises would you suggest, especially for diabetics, which can be easily done at home?
Yeah, very nice question. Because diabetes is a lifestyle disorder, and the diet and lifestyle modification are the main two pillars of the diabetes management. So ideally, two types of exercise recommend. One is aerobic and one is the resistant exercise. And ideally 30 minutes per day and 150 minutes per week is generally recommended for type 2 diabetes mellitus patients for lifestyle modification. But recent COVID-19 pandemic area, some exercise can be done easily and safely at the home, like dancing, walking, mild stretching, pranayam, yoga. So what are the main advantages? So exercise mainly improve your insulin sensitivity. So it improves your blood sugar level, it reduces your blood pressure, cholesterol, fat, tension, stress, and it also improves your muscle tone and basal metabolic rate. And with the help of yoga, you can promote your physical and mental health, and it improves your physical well-being, your posture, flexibility, circulation, and most important, your concentration. So this should be done under the expert guidance. So diet and lifestyle modification, you can control your blood sugar level and you can live the quality of life with type 2 diabetes mellitus patient. Thank you.
All right, and a reminder to our viewers that you can WhatsApp us any questions that you may have for the doctors. The number is being flashed on the screen, so do send in any queries you may have. Now, Dr. Gupta, what is the glycemic index and why is it important for people to know about this?
Yeah, glycemic index, it was designated for diabetic patients. It's a very important thing. And it's a measure of how quickly a food causes our blood sugar to go up. So if I'm eating a food that is giving with high glycemic index, my sugar would be high. And you know that diabetics should keep their blood sugar in a range to prevent complications of diabetes. So we have certain foods that causes less glycemic index, like it's a measure from 0 to 100. The sugar foods that is their glycemic index is more than 70, like white baked potatoes, white bread, all sweetened beverages, whatever we eat, and white rice, this is all high index. So if you eat that, your sugar would go up. If you just take medium GI index food like bananas, grapes, maybe ice cream also, resins and corn, they are medium. They are also causing your blood sugar to go up, but less amount. And the safest things, low GI foods, that is the score is below 55, that include oatmeal, peanuts, all nuts, whatever you eat, all grains, pulses, kidney beans, skim milk, and most fruits. So fruits are good for us. And when you eat something, maybe you can combine sometimes, if you want to eat something sweet, just combine high index with low GI index. So this is a very good measure for diabetics. So you can enjoy something sweet also, and by the same time you will have a less excursion. Sugar would not go up. So it's very important measure. So my dear friends, just don't worry. Diabetics should not worry about everything. Just be happy, control your blood sugar, and sometimes you can eat by measuring GI index, keeping in mind about this. You can enjoy foods also, delicious foods also. Okay?
All right, that must be reassuring for diabetics. It's all about managing the disease. Now, Dr. Parekh, what are the advantages of the HbA1c testing over glucose measurement for diagnosing of diabetes mellitus?
Yeah, very nice question. Earlier we used fasting and postprandial sugar, but it only reflects the 1 day and 1 time blood sugar. But the new parameter HbA1c, it is a glycemic index and it reflects the glycemic control over the last 3 months. So according to the all latest guidelines, ADA, EST suggests the use of the HbA1c, and if HbA1c is less than 5.7, it's normal. If HbA1c between 5.7 to 6.4, it's borderline or pre-diabetic, and if HbA1c more than or equal to 6.5, it's diabetes. So with the use of HbA1c, you can start the therapy, you can titrate the dose of your treatment, you can, according to HbA1c level, you can up titrate or down titrate the dose, so you can prevent the hypoglycemia. And I already mentioned 1% HbA1c reduction, we had significantly reduced the stroke, heart disease, retinopathy, neuropathy, nephropathy, and heart disease. So with the help of the HbA1c, you not only control the blood sugar level, but you can prevent the retinopathy, nephropathy, neuropathy, and major heart disease, stroke in the future, and you can achieve the good quality of life. Thank you.
All right. Well, thank you so much, doctors, for answering all those questions and, creating awareness about management of diabetes, especially in these difficult times of the pandemic. Thank you, doctors, for joining us again, and thank you all for watching. Goodbye.